Scott here, Hub Media Video. This month we're at Clark's Pharmasave, and we have two guests. We're pretty lucky this month. Shireen, a pharmacist here, and Barbara, a natural health consultant. And the question I have for both of you is, how do you guys work together? It's kind of neat to see that you guys, I heard about some antibiotics you guys are helping some patients with. So talk about that and what it does. So your job first is to make sure they're healing, right?
Prescriptions, yeah. For antibiotic prescriptions,
Yep.
like it's deplete all the bacteria. So for the balance, I refer her, and she prescribed the probiotics for patients.
And what's your end of it, Barbara? Like, how do you correspond together with Shireen?
Okay, Shireen's wonderful to work with. Very, very easy for us to talk to, and it depends on the type of antibiotic that somebody is on for the choice of the probiotic. And so if it's a broad strain antibiotic, we'll use a broad strain probiotic to deal with that. If it's something more simple, so lots of different choices, and you really need to fit them to the patient and what their needs might be that way. But very, very effective in preventing a yeast infection, perhaps, or gastrointestinal problems. So that's what the balance is.
Especially irritable bowel syndromes.
Absolutely.
Yes.
And I noticed when you guys were earlier talking with a patient or dealing with a patient, how you both came together. Like it's teamwork, eh? Isn't that what it's all about?
Teamwork, exactly. It's a teamwork. Whatever I have, I refer her, and she is helping me too.
That's great. And sort of down the road, like with what you guys do together, if I was coming in and I wasn't sure, where would I start? Like if I, obviously most people come to see you first.
Recommendation, exactly. Whenever they are coming and asking the recommendation, especially sometimes patients are coming for muscles pain and they're not sure. Usually we have the muscles pain sometime when we are less magnesium or calcium, iron, and B complex. So
to Barb they go.
To Barb, right.
And the other part about this is, and we were talking earlier, is vitamins. Critical, right? Like that blends right over again, doesn't it?
Yeah.
Can you talk a bit about that, Barb, and the importance?
The perspective that way is that when somebody's prescribed an antibiotic or any other type of prescription drug, it's the potential that it depletes different things in the body.
Right.
So what you're doing is supplementing with what has been depleted to prevent other complications. For instance, with a statin drug, which people use for cholesterol, it depletes the body of something called coenzyme Q10, and it's critical to replace that particular nutrient because it helps protect our cardiovascular system and many other functions. So it's learning to take that, not just replace that supplement, but also keep it several hours away from the prescription medication. But the beauty of it is with the integration that we do, is the patient's best interest is always taken into consideration first.
It's great. Stop by Clark's Pharmasave. Visit Shireen and Barb if you have any questions. It's all about balance, isn't it, ladies?
Absolutely.
It is the balance. It's a teamwork.
Teamwork. All right. Well, thanks for doing this today.
Thank
It's great
you.
to have you both in.
Thank you.
Thanks, Shireen.
Thank you, Barb.